So what are the steps to having your vision corrected? Step 1 is to come in and see me for a personal consultation so I can personally examine your eyes to determine if you're a candidate. Mainly, we want to make sure there's no other eye diseases that might interfere with the success rate. Once we determine that you're a candidate, then we need to do some detailed preoperative testing to map the specific shape and size of your eye. That testing usually takes about an hour here in the office. Once we have all that information, we can create a custom treatment plan for you and transmit that information to our laser. We then need to schedule a day for you to have the laser surgery. What usually happens on your LASIK day, you arrive at the office and check in, and we give you a Valium to make sure you're relaxed and comfortable during the process. We then move you over to the laser center where we administer eye drops to anesthetize the eye, numbing drops. The procedure itself is not painful because of the eye drops. The actual laser treatment itself will take 15 to 20 minutes. It's not painful, and afterwards your eyes usually feel pretty comfortable. Most people following the procedure go home, take it easy, take a nap, and have very little if any discomfort. Immediately following the surgery, you'll be able to see okay, but it won't be perfect. Usually 2 or 3 or 4 hours after the surgery, you notice a dramatic improvement in your vision, and certainly by the next morning, you'll notice a marked improvement in your vision. Most people can see well enough to drive themselves to the office the next morning for a checkup. The day following surgery, we'll check your eyes in the office, and most people notice a dramatic improvement in their vision. In fact, the majority of patients would see well enough to pass the DMV driving test the day after surgery. Our goal is always to help people see 20/20 or have normal vision with no corrective lenses. Sometimes your vision may be even better than that. Following surgery, we'll provide you with antibiotic eye drops to prevent infection and to assure that the healing process goes smoothly. These eye drops are typically used for approximately 1 week.
When I first met Dr. Poulsen, like I said, he was really friendly, he was very charismatic, and I had actually seen his commercials a couple of times, but honestly, I had called one other place, and they didn't answer. I left a message, then I called Dr. Poulsen's office, and they answered right away.
Dr. Poulsen is wonderful. I've been going to the Eye Institute to see him and a couple of other doctors for over 20 years. He makes you feel very comfortable. My mom even went to him, and we really like him and his staff, the whole staff. I mean, if I didn't like him, I wouldn't have been going to him for over 20 years.
I would highly recommend Dr. Poulsen and Insight Vision Center to any of my family and friends. Their courtesy and their professionalism was unparalleled to anything I've ever experienced.
A lot of the people that worked there had actually had LASIK, so that you could actually relate to. They knew what you were going to go through and everything, and the atmosphere was just friendly. Everything looked nice, nice office. And the fact that you actually got to meet Dr. Poulsen too was, yeah, I mean, I told my wife, you know, hey, it's the guy from the TV, so.
I went for a consultation with Dr. Poulsen, and it went real well. I had already made up my mind that I was gonna do it, because I talked to a couple of his staff that had the monovision, and I go, hey, well, they really looked like they went through it okay, and they're doing really good.
Yeah, he made it real clear. He had a chart and everything, and he just explained what was wrong with my eyes to begin with, and how they were going to correct it.
Dr. Poulsen before the surgery was very helpful and very informative, educated me very well on the procedure, made me feel comfortable that I was a good candidate for the procedure. And then during the surgery, what made me really feel comfortable was that he was walking me through the procedure as we went through it, was explaining to me what was happening and you know, what I could expect with the next, you know, as the procedure went forward. So.